Part 2 of our program, what happened to Thomas when he tried to talk about his issues with anyone in the conventional medical model. We're going to go back and forth between his beautiful haikus and my reading directly from Thomas Fredrickson's medical records. And here we go. Entry, March 22nd, 2013. Patient states he has, quote, a lot of stuff that is hard for me to talk about, unquote. And with some hesitation, patient endorsed that he was sexually assaulted on September 30th, 1975, when in the hospital in Concord, Massachusetts, when patient was 2 days old. Patient is currently disfigured on his genitalia due to this, and it significantly bothers him. Parentheses, this was brought up at the end of today's visit.
Myopic prisms. Seen through the prism, cut are boys but not girls. Latent sexism. Seen through the prism, how horrid they cut girls. Ethnocentrism. Seen through the prism, cut babies if they can't say no. Latent ageism. Seen through the prism, cutting for 3,000 years, bad Bronze Ageism. Seen through the prism, my cut penis is just fine, denialism.
(4:13). Patient presents 5 minutes late for scheduled follow-up appointment. Patient stated that when this examiner asked about the extent to which the patient's genitalia had been disfigured, he states, quote, I should just show you, unquote. Additionally, he states that he has been participating in online forum for men who have been victims of sexual assault by American medical workers, as he states he is sure the assault on his genitalia when he was 2 days old was done by an American doctor. Patient progressed to get his computer out to show this examiner some web content, but patient was redirected, where he was informed that his care through the medical institution will be transferred to Dr. Hawk as a decision made in his own best interest.
Doctor insisted, my young mother relented. Now I'm cut for life. 2-day-old infant. 2-day-old infant, it is not yet a person. Have your way with it. 2-day-old infant, you decide as you own it. Have your way with it. 2-day-old infant, own it, mark it, brand your thing. Have your way with it. 2-day-old infant, help yourself to its penis. Have your way with it. 2-day-old infant, when does it become a him? What will he think then?
April 2013. After discussion with team and with supervisor, Dr. it was decided that patient's psychiatric case will be transferred over to Dr. due to the complexity of the case. I believe patient has many underlying psychological stressors, including physical abuse history perceived by himself as being at the hands of a healthcare professional, rejection, abandonment, fear, identity disturbance, impulsivity, splitting behaviors, including all or none thinking, and impulsive behaviors. Thus, there is a high suspicion for a cluster B axis 2 diagnosis. Thus, patient would likely benefit from therapy setting while considering DBT, dialectic behavioral therapy, referral, while exercising caution as to patient's history with medical professionals. Editorial comment from the once in the system but outside the system of the belly of the beast. That means they're starting to get a little itchy about somebody who could sue their asses off. May 2013. Case discussed previously with Dr. Scheduled for 30-minute follow-up today, ideally should be evaluation slot time frame. Patient with history of cluster B traits. Concerns he has been, quote, genitally disfigured by healthcare professional at 2 days of age, unquote, with significant boundary issues with prior clinician. Spent most of this session working on empathy and setting limits within a productive doctor-patient relationship in this 30-minute visit, and patient agrees to follow up for full evaluation.
When cut men speak out, they express their sense of loss. Their message is lost. When cut men speak out, they express their betrayal. No one wants to hear. When cut men speak out, they express their resentment. Just get over it. When cut men speak out, they express their enragement. People laugh at them. So cut men don't speak. Their pain is hidden away. Cutting continues.
So anytime we're getting ready to get to sort of the meat of what we wanted to discuss here, we're going to have 5 basic ideas, and Thomas is going to ask Opeyemi for her answer.